This video is part 3 in our soft tissue-based shoulders injury series. The focus of this video will be on the function, palpation, and treatment of the infraspinatus muscle. What's up, everybody? For those of you that don't know me, my name is Dr. Matt Maggio. I am the creator of the 𝘚𝑗 method and the founder of the soft tissue revolution, where we teach manual therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. In part 1 of this series, I went over the clinical presentations and functional based testing. If you're watching this on YouTube, I will link that up right above. In part 2, we went over the posterior shoulder capsule, specifically the function, the palpation, and the treatment. I will also link that up right here if you're watching on YouTube. If you are consuming this on Facebook or LinkedIn, those videos will be in the comment sections below. Infraspinatus, very important in shoulder function, shoulder stability. It's very important anytime the shoulder is moving in a pressing motion or reaching motion. What it does is it really stabilizes that shoulder from the posterior part of the shoulder and keeps it from moving too much, because the shoulder doesn't want to move around too much. It wants to have good stability as it's going. So why does the infraspinatus get so overworked and develop scar tissue? You know, scar tissue is like glue that gets inside the muscles, makes it weaker, less flexible, and puts more wear and tear and everything around there. A lot of times, you know, people are spent in a very sedentary posture where they're rolled forward, their shoulders are rolled forward. Those muscles are constantly stretched and contracted. When they are, doesn't get enough blood flow, doesn't get enough oxygen, and in turn starts to lay down that scar tissue. Also in overhead athletes, people pressing, lifting, blue collar workers, all that stuff can really cause some issues in that muscle as well. So when scar tissue forms in the muscles and around the nerves, in the ligaments, that muscle becomes weaker, less flexible. The force has to go somewhere. So what ends up happening is it puts more force on the joint, on the cartilage, and on the tendon. And a lot of people end up having degeneration of the rotator cuff tendons, cartilage damage, and just tendon damage across the board, because this soft tissue problem happened first. And a lot of times it begins in the infraspinatus because it is so important in overall shoulder function and stability. So the first video I want to include this week in the training is going to be an advanced palpation of finding the infraspinatus, because I always say if you can't find it, you can't fix it. So I'm going to link that video up right now. The thing we're going to do is just get in there and palpate the infraspinatus. So one trick that I like to do is I like to have a little bit of tension here. So I'll have the patient just kind of reach around and open up their arm. That gives a little tension on there. And then what I do is I just find my landmark. So here, across here is the spine of the scapula. So I know infraspinatus lives anywhere in through here. So what I do is I just get in there and I'll just sink in and palpate. And what I'm trying to feel for is areas of decreased compressibility. That lets me know that that's area of scar tissue. And there's a pretty good one right there. I'll check that whole muscle. A couple take-homes from that training video and the palpation. One is using landmarks. Find bony landmarks to know you're on it and you're exactly on it. And then just slow down. Never be in a rush. Get in there, slow down, palpate, and find the area where that dysfunction is, because if you know exactly where it is, you're going to be able to go and fix it the best of your ability. Now that we know this is a problem, we've palpated it, now we actually have to go in there and treat it. So what I want to include next is an advanced treatment demonstration of my treatment called manual scar tissue treatment, specifically to the infraspinatus. So I'm going to link that video up right now. So we're going to do the treatment on infraspinatus, and this one is a very important treatment. A lot of times people are too compressive and don't account for the angle of the scapula. So the way the shoulder sits in just like this is essentially it's kind of curved a little bit, and that infra goes right through here. And what happens is people become too compressive and they don't get the proper depth and tension, and then it just gets stuck and it doesn't slide. So for this treatment, I like to have the client sit in a chair. Anytime we get the client to sit in the chair, it's better for you and also for the client as well. The key here is the client is going to help you with the motion. And what you're going to do is start their arm just like this, and they're going to bring it straight across, nice and easy. When it gets close here, you're going to have them grab on the other arm and pull just slightly. Now they're not trying to like yank it all the way over. It's a nice, easy, gradual motion. When it gets close here, you want to pull it in just enough for that elbow to clear the chin. So you want to make sure the client really understands the motion, because if the motion isn't good, you're not going to deliver an effective treatment. So the key here is the actual vectors and the way that you go in. So a lot of people go straight in just like that, and it doesn't allow you to get an effective treatment. So essentially what we're going to be doing is this arm is going to correlate and line up with that, kind of just where it was in like that, where I'm going to come in just like that. So a lot of people are here. We want to actually get our depth in like that and our tension across to account for that curve of the shoulder blade, because it's about a 40% curve. Now the client already knows the motion, so essentially what you're going to do is you're going to get set up just like this. And you don't need to be too compressive in here. All that's between you is some skin, some subcutaneous fat, and then the actual infraspinatus. And it doesn't need a lot of pressure. Now, the first thing you're going to do is line that up just like that. Now my thumb is nice and lined up, and I want to make sure my arm goes down into that vector. Then I'm going to go at a 45-degree angle just like this, and I'm going to back that thumb up. And essentially, I'm going to sink and get my depth by just pushing very slightly with this opposite pec. That's going to get my depth. And then my tension is going to be a body lean across just like that. So what you'll see is essentially the pec gets that, and then my tension is going to be leaning away. And what I'm going to be doing is dropping my body towards the opposite way there. And you want to be at that 45-degree angle. So the client already went through the motion, they know what it is, and you're going to set up. So you're going to go in just like this, going to sink in a little pec push, and then a body lean just like that, and then the client's going to move it across. We're going to force that scar tissue to come to us. This is internal slide. Okay. Now I want to show one without me backing it up. So we would have got the depth just like that, and then our tension just like that, and I'm staying here and I'm letting it come to me just like that. Nice. So as we said here, the vector is very important here, and the setup is as well. See how I'm pointing away? It's almost like I'm going there. A lot of people come in too much here and they're not going to get the correct motion. So the key is in that setup. So I'm here, I'm nice and crouched down in a good position, very strong in my legs. Then I get my depth with this push, and then my tension is leaning with my body. Go ahead, and I set it and let it come to me. And I force that to roll over. Now this area is very common for a lot of scar tissue. The problem is everyone is way too compressive. And if you're too compressive, you're not going to get the right amount of depth and the right amount of tension, and you're not going to break that down. But if you can set up properly and take the time to set up and make sure your mechanics are right, your elbow is lined up, it's going to make for a much more effective treatment. It's actually going to fix shoulder problems. A couple take-homes from the treatment video. Once again, slow down. In order to go fast, you must go slow. Be very precise with your depth and then your tension, because so many people go in there and they actually treat too aggressively in that area. That muscle is very thin, and all that's between you is like some skin, some subcutaneous fat, and then the muscle, and it's right against the bone. And what I find is that way too many practitioners are way too compressive in there, and when they're compressive, it doesn't allow for that tissue slide. The tissue slide is what actually breaks it down. You need proper depth, then tension, then have the client go through a full range of motion. That's what's actually going to break down that soft tissue dysfunction. In our next video of this series, I'm going to be covering the subscapularis. So be sure to check that out on the next one coming up. If you like this video, give it a comment, a like, a share. Any insights or epiphanies you might have, share them in the comment section. I always like to read those, and I try my best to respond back to anyone that sends over comments or questions. Also, go grab our free training. In our free training, we really dive into critical thinking, functional-based testing, palpation, getting you on the idea of not just providing a service, but instead providing a solution. And if you like the free training, we do offer full CEU courses. They're available online and in person. Appreciate you guys watching the video, and I'll see you on the next one. Bye.